a new toy that I started playing around with in the summer. And when I first became aware of this, it was through a video advertisement. A company called Marina Medical makes what they call the Martin's arm. And it's been around. You know, it's been sort of not used in too many centers, but there was a well-known pelvic reconstructive surgeon that had been using it for vaginal hysterectomy. And he had 4 of these arms holding retractors, and he was able to do a vaginal hysterectomy with no assistant. And so when I saw this, I was intrigued. And I said, you know what, there's a place for this in office-based surgery where sometimes the assistant is somebody who has no training, or it's a different person every time, and you have to go through working with people at different levels. And in an office setting, you want to be as efficient as possible. So I called the people at Marina Medical, and I asked them to send me a couple of these arms to play around with. And as a result of playing around with these things, I designed several operations around them. You can see the core of this whole thing is this arm that can hold and clamp things that fit inside the jaws, which is a space of about 2 centimeters, which will hold anything that I would ever need to hold as far as an operating room instrument. And this just shows you how these clamps work. Here I can put any instrument that I would normally hold in my hand and release it quite easily. They also hold endoscopes. So if you ever want to use these things in open surgery, you can just attach them to an endoscope, and you have a very stable platform. This is a little bird's eye view. It hooks up to what we call the whirly birds. And these arms articulate at 3 points. And when you lock the mechanism at the jaw, the entire thing holds the shape at whatever position you articulate in. So it's very useful. You lock that, and the entire arm locks in position. So I go through a couple of the reasons why I love these things so much. But most of all, it's for improved performance. Okay? If I want to do an operation, and I want to repeat that operation, it's easier to repeat it if you can rely on your assistant to be consistent and perfect every time. There's no variation in the operating room environment. It's just the particulars of the case. So this is how you hold the instrument. And compared to the human hand, okay, I can hold something. After a certain amount of time, I'll develop a muscle tremor. And after a certain amount of time, I won't be able to hold the position any longer. For vaginal surgery, that's the #1 failure in an assistant. They just can't hold the position long enough. So this eliminates that completely. This holds a position as long as you keep it in the position that you're looking for. Now, as far as range of motion, this exceeds the range of motion of the human arm, because I can only move my arm in certain directions. My elbow doesn't go past 180 degrees. This goes as far as you want to take it. And also, it's always available. Okay? If I have an unscheduled case that I have to take a look at and I don't have my assistant, she went home for the day, I get my robotic arm, I'm good to go. Now, some people have assistants with a large belly. Okay? That belly is going to be in your operative field, making your working space much smaller, much more uncomfortable. Okay? You can't work when you're crowded. It's like working in a crowded subway train. If you have an assistant with short arms, okay, you can't put them in certain positions. So having something that has no feet, okay, it takes up no space, is superior to the human. When you say something to an assistant and they don't hear you, or they hear you wrong, they make the wrong move. Okay? This has no ears. This puts it wherever you place it. It does what you want it to do every time. It's doing exactly what you want it to do. And there's no variability in the performance. Okay? It doesn't have PMS. Okay? It doesn't have back issues. It doesn't have carpal tunnel syndrome. It has nothing that affects a human. No, I'm not criticizing. I'm just enjoying. It's cheaper. Okay, you know, you can replace an assistant with a piece of metal that does everything the assistant can do better. All right, so when we measure performance, we measure different parameters. Okay, the ability to do a job can be compared in different scenarios on the basis of precision, speed, cost, and what I call intangibles. So let's go into these a little bit because this will affect how well you perform your surgery in your office. Okay, if my assistant moves around, it's difficult for me to hit the same target every single time. So it's hard for me to do this if I'm on a boat and everything is floating around. If I'm on a stable platform, I can hit a bullseye every single time. Okay, what else I get is what we call economy of motion. Okay, if you can move efficiently in every phase of a procedure, you have no stress. When you have no stress, you can think more clearly. And when you can think more clearly, you can address any unexpected changes in the surgical situation. So what this all translates into is a stress-free surgery. You're more focused on the work rather than the exposure to do the work. And you're less likely to get into trouble because of working under suboptimal exposure conditions.